Next, Rowland Thompson, Bill Will, and Ric Smith.
No good deed goes unpunished.
So again, Rowland Thompson, Bill Will, and Ric Smith.
Mr. Chairman, members of the committee, my name is Rowland Thompson. I'm here with Allied Daily Newspapers of Washington, and I'm here specifically on concerns that have been raised by my members about sections 8 and 9 of the bill, which have to do with public disclosure. We are not seeking the names or identities of patients who are involved. We would assume that HIPAA has control over those issues and the disclosure of those lists, but we are very much concerned with those that are involved with the growing and the dispensing of it and the disclosure that would exist around those, so that we're able to do some sort of examination about the people who are involved in the distribution of marijuana in the state. And I will leave Jim Neff, who's the editor of the Seattle Times for Investigations. His comments are before you on a one-pager, and I would urge you to read that if you would, please. It shouldn't take but a couple of seconds, and I will leave it at that. Mr. Bill Will is here with me from the Washington Newspaper Publishers Association on the advertising issue.
Thank you.
Thank you again. For the record, Bill Will, Washington Newspaper Publishers Association. I'd like to address briefly Section 6 on page 13. Item L, a nonprofit patient cooperative may not advertise cannabis for sale to the general public. Is that an outright advertising ban, or is there some wiggle room there? I'll tell you what the current situation is with my members, and I fielded probably a dozen phone calls in the last several months from member publishers asking if they can run, if there's any prohibition running medical marijuana advertisement. And it's I give them a two-part answer. One, no, there's no prohibition. But two, that doesn't mean you have to accept that advertising. That's your prerogative as a publisher. If you're not comfortable with it, or if you think it violates your advertising standards or the standards of the community, you don't have to run that advertising. And frankly, that's where the decision should remain with the local publisher. There could also be some constitutional questions with a blanket prohibition of advertising. There's a wide body of case law that maintains that commercial speech has the same First Amendment rights as any other kind of speech, and I'm fairly confident that my lawyer would tell me that when he looks at the rather nebulous language that's included here. I applaud Senator Kohl-Welles for persistence in this issue. I think she's done a masterful job managing the various constituencies that are fighting over this, but I think with all the people lining up to take shots at this legislation, I think the last thing it needs is a First Amendment problem. So I would like to see this concern addressed, and thank you very much.
Thank you. Next.
My name is Ric Smith. I'm a patient. I'm a member of the Cannabis Defense Coalition, and I just thought I'd tell you guys my conditions, 3 of my conditions that are authorizable. First, it started with HIV and AIDS, and that's up for appetite and nausea. With 38 pills a day, you're not very hungry afterwards, and it also, the nausea kind of prevents you being hungry. Because of the HIV medication in the 80s, I developed neuropathy in my feet, and the pain pills that they give me, I can't walk. You know, I'm too goofy. I'm unstable anyway, but they make me loopy. And if I don't take them, the needles, I can't walk. If I smoke a little bit of pot, I can. Another thing that the HIV medication did was knock out my kidneys. And I go to dialysis every other day. And I don't know if you're familiar with dialysis. It's a great process because, I'm here on this side of the dirt, but it's torturous. It really is. By the 3rd hour that we're sitting in that chair, it really takes a toll on our body. Thank goodness for the Medical Quality Assurance Commission. On this respect, the bill's kind of incomplete because last year the Department of Health okayed chronic kidney disease requiring hemodialysis as an authorizable condition. Now, I have many more conditions that someday soon will be authorized. These treat me well, they keep me functioning, they keep me participating. And the thing about the registry, 2 of my doctors that have signed authorizations have only signed the authorizations for me. One of those doctors, it took 9 years to get him to sign it. He had to watch what was happening. He had to chart everything. He had to see my progress. It took 9 years. If we mix him up with another set of hoops to go through with the Department of Health, he's not going to do it. And the same would be true for my nephrologist. Was all happy that the kidney disease was qualified, but when I discussed this with him, he said no, it would take more of his time and it isn't worth it. So I want you to consider that. You know, people are complaining about Big Brother. That's not the issue. The issue is my doctors won't sign for me. If I'm limited to one provider, what if my provider gets spider mites? You know, how am I going to get another provider? They say I can also join a nonprofit collective. I don't have the money to join a nonprofit.
I need you to summarize.
Oh, okay. We would like to regulate the dispensaries. We really would, but I really don't think it should be at the expense of patients.
Thank you all very much.
Thank
Appreciate
you.
it.